because they're poor and
No, I've arrested people that have money that steal. They just like the sensation of it.
the rush.
There's all kinds of different reasons for why people do what they do.
But the idea that we as a society should treat crime with punishment rather than understanding the root causes and trying to address them, is it not just inherently
So what do you suggest that you do with somebody that commits a crime?
To understand the circumstances that led to that moment and to try to prevent them.
So somebody that's well-to-do and commits a homicide, what do you do with that? You can't say that their situation or their life, them being poor or anything.
No,
like that
it might not be. Not all crime is related to poverty. Majority of it is. But the idea that somebody who is wealthy who commits homicide, you know, is inherently required to sit in jail for the rest of their life as punishment doesn't necessarily resolve the issue from occurring again in some other case.
It doesn't, but what do you suggest we do then?
Mental health services, right? Somebody who is mentally stable isn't going to go and shoot somebody.
True.
Clearly the homicide rate in this country dictates that prison isn't a deterrent, right?
Yeah.
Murders still happen, murders happen everywhere. What a deterrent is people having a stronger community where they're not
but that doesn't work for some people. Some people just do what they want to do, whether they get mental health or not.
Okay.
So what do you do with those people?
But you understand
there's a huge
you
mental
rehabilitate
health crisis. Not everybody can be rehabilitated, and I think that's what you're failing to see. Is this country has a huge problem with mental health, okay?
Yeah. And a universal healthcare system would fix that.
No,
correct?
it wouldn't. Why would that fix it?
Because then people can access health services.
They can access health services. I grew up very poor. I grew up without insurance, and I never went a day in my life without health insurance, without being able to get help. I never went a day in my life, and I grew up in the city and county of Denver. Whenever I needed health or I needed dental, I needed medical services, I was able to get it.
And a lot of those services have been
they're still there,
defunded and reduced.
You're mistaken. They're still there. Why do you think DG runs $80 million in the red every year? Because they take care of everybody. They don't turn anybody away.
450 million goes to the police department.
No, it's not 450 million. And law enforcement, I grew up very poor in a poor neighborhood, so police are very necessary and needed, okay? If without police, where I grew up, without the police, it would have been horrible. You grew up
surrounded by crime because of the poverty that surrounded you.
No, I never committed a crime in my life.
Right. Not everybody who's poor is a criminal.
But that's where you're mistaken, because just because you're poor doesn't mean you have to commit crime, okay?
No,
I grew up
those
poor.
are conditions that lead to a lot of crime. I'm not saying everybody who's poor commits crime. Okay. I'm saying people who commit crime are usually poor.
But it's choices you make in life, and that's where everybody is mistaken, okay? I grew up poor. I didn't have anything. I was single parent, 5 kids, government housing, and I made choices in life, and my choices made me better.
I think the point is that you had a network of support that
my mother worked 3 jobs a day.
Right, but what I'm saying is you had a network of services that allowed you to provide for yourself enough that you didn't see a criminal aspect as the avenue you could go towards.
I have friends that went that way. It's just choices you make in life. That's what everybody is they don't understand. I grew up in it. They don't understand that. It's choices you make in life. I have a little sister. She made bad choices, so she paid for her bad choices. My other 4 siblings, we're all doing well. We don't rely on the government. We take care of ourselves. We work hard, and we all have nice things. And we grew up in poverty.
Yeah, but the point is that these conditions that are becoming more and more evident today, such as this homeless sweep, meanwhile, you know, the richest people in this country are $1 trillion richer during a pandemic, and 40 million people are facing eviction. You think this is big? Wait till January starts happening and the evictions start kicking off.
Yeah, well, hopefully the country won't do this pandemic thing, and they'll let people get back to work. So here's the thing with the pandemic. For one, here's a couple things that I want you to consider. When in history have you ever quarantined healthy people? And when in history has a pandemic ever had a success rate of getting better of 99%? It's never happened in history.
So
The pandemic, in my personal opinion, it's not a true pandemic, because a pandemic is like the Spanish flu. 50 million people died around the world
because they didn't take those precautions. They did.
Down. They were wearing masks.
There was
they were doing
very
all of that
few
stuff.
mask mandates anywhere. The only mask mandates there were from small municipalities.
Okay.
Small towns may have said something, but majority of the approach was to do nothing, and it led to 50 million.
Have you
deaths.
seen the latest research on the mask wearing mandate, or have you seen the science on it?
I've followed up with it. It's not something that I've looked up recently.
So the increased risk of not wearing a mask is 0.03%. That's published, and it's research that was actually done with 2 test groups. And this was done in an environment where nobody wears masks, but they had 3,000 people wear masks, and they followed 3,000 people that didn't wear masks, and the percentage of people, or the increased rate of infection was 0.03%. So it's not even 0.5% of the infection rate. So the masks basically don't really do us any good, and yet the whole pandemic thing, I have an interest in it, so I'm looking into it, and I follow all the statistics and all the new science and everything like that. The masks don't do anything for us. It makes people feel good psychologically. That's about all it does. And if you actually go to AmericaFrontlineDoctors.com, there's a website put up by doctors. If you go and look at their everything that they've published, we're doing more harm to people mentally, shutting society down, because the suicide rate is going through the roof. And the mask mandate, the masks aren't doing anything. Not to mention the fact that psychologically you're going to damage all the children, because they can't see facial expressions, and that's what they go off of growing up. And I
think that's a random argument to
no
make.
It's coming from the doctors. I'm not making it up.
Yeah.
So so you got to look at the science.
There's a consensus that a shutdown is necessary.
Okay, but you got to look at look at what's backing the consensus. Do you also know that in Japan,
big science, those
No, it's not. It's faulty media. That's what's doing it. It is. Look at the science behind it. Look at the science. I'm not asking you to believe me.
I'm not looking at the science, because I'll listen to people like Dr. Fauci, and I'll listen to their advice.
Okay, Dr. Fauci just came out yesterday and said that we shouldn't shut schools down, that he was wrong.
So the school part is an interesting piece of information, because the study they've done shows that young kids aren't necessarily the major factor of transmission. So it actually always was an indicator that
so they should have never shut the schools down then, right?
No, because the teachers are still at risk. There's an entire infrastructure around
so if you look at the age categories, 19 and under, you have a 99.987% of recovery rate from the coronavirus.
Right.
If you're under the age of 70, you have a 98.8 chance of recovery rate. So, and any of the teachers have just as much of a chance of recovery percentage-wise as the kids do. Everybody's going to get sick. You can't get rid of a virus, can you?
But you can vaccinate against it if you develop a vaccine.
But you still get the flu.
Yeah, because the flu mutates every time.
And so does the coronavirus.
Your flu, but this one was a significant mutation. But the flu, when you get a flu jab, you get vaccines for 4 different flu strains. But we've done the lockdown, we've done all this stuff.
It hasn't worked.
It's still 200,000 dead in America.
No,
if we didn't shut down,
that number's seriously skewed.
Okay, I'm not part of that argument, and I see massive issues
if you follow the CDC, that number's hugely skewed.
No, I don't think it is. But
yeah, it is. Why do you say that? How many people have died this year from obesity and from the regular flu?
The regular flu hasn't really kicked in yet, because the flu tends to kick in.
But they're not tracking
in the winter.
The CDC actually said they're not tracking the regular
flu statistics on average. I think about 60,000 a year normally.
85.9 thousand died last year from the regular flu in the United States. Obesity, 300 people died in the United States from obesity last year, and they're not tracking those deaths this year because they're attributing them all to the coronavirus.
Well, the reason you attribute it to the virus is because pre-existing conditions lead to complications.
Obesity doesn't exist anymore?
No, it does, but obesity is a factor in getting people to be sick and have worse recovery rates.
So you can't blame it solely on COVID then?
No, but those people would have been fat and alive if they didn't get the virus.
300,000 would still die this year.
Okay, my main point about the virus is